I welcome you once again for one more interesting session for Celeb Talk. And as we have promised in the last episode, we are once again back with a very distinguished guest. And she is known for her work, she is known for her charming nature. And I welcome our special guest today, Miss Magdalena Snowden. And she is one of that special personality who has always inspired me since the time I'm in Dubai. And I always look up to her for as a lighthouse of mental wellness because Miss Magdalena Snowden has always been so down to earth, rooted to her culture, but at the same time been very agile, always inspiring for leaders and people who are really wanting to go for blissful living. So, who is Miss Magdalena Snowden? We'll definitely know in this special podcast today. And we would just try to explore that how exactly we can break the silos and we can break the barriers for blissful living and how exactly we can foster the mental wellness at our workplace. So today we are meeting a special personality who has always excelled the field of healthcare with a rich background in leadership coaching. She has walked the 5 steps of mental agility and she has helped the leaders to navigate how to really handle the stress, how to overcome the different challenging situations of life, and how exactly you can really have the mental wellness. So, without much ado, I would really request our special guest today to share a few experiences about her, and of course, before that, to introduce herself and tell us that how exactly the session is going to be interesting and interactive today. Welcome, Ms. Magda.
Thank you so much, Premankur. Good afternoon, good evening, and maybe even good morning to whoever is tuning in to this conversation. I'm actually listening to this introduction and thank you for highlighting some of the aspects of my personality, career, and my journey that sometimes I might take for granted because, yes, it has been a journey. And my professional background is nursing. So I have been in nursing for over 20 years. I have worked in the NHS in the UK, so public healthcare system, and then also in Dubai and Kuwait, so private healthcare systems. My passion in my current capacity of mental agility expert is providing people with stress and burnout solutions. So as you rightly highlighted, the blissful living, what do we need to do? How do we need to upgrade our human skills to move from the survival zone to thriving zone? Because as humans, we are here to thrive, not to survive and not to live and work in chronic stress cycles. So my background is in nursing, healthcare leadership. I wear many hats. So when I say mental agility framework or consultancy, I use variety of tools. So training, mentoring, facilitation, coaching. I'm also an NLP practitioner, mental health first aider, positive psychology practitioner, and so on. So when I say I have all these tools in my basket to help various individuals in their journeys, is because every single human is a unique being. It means there isn't a blanket approach or a one-size-fits-all when it comes to finding your well-being space, finding solutions that move you from survival to thriving. So yeah, it's all about agility, flexibility, trial and error, having a play with variety of tools before you find that one or two magic tricks or magic solutions that really are gonna take you to a different space.
Correct. So, how do you think this topic is so appropriate? Because I believe that everywhere which we look at, we find that people are always stressed, and sometimes they are silently going towards that stress without even knowing that. And they only realize when they come to a breaking point. So, how do you think that breaking the barriers is really important, and how the workplace silos is impacting the mental wellness? Because you being a wellness expert, I'm sure you are always coming across such situations.
Thank you. This is a super interesting, but also a very complex question. So, when I work, for example, with teams or leaders in organizations on exactly the same issue, first of all, the main component of my mental agility framework is science. So, when we as humans don't understand something, we struggle to find solutions. So I will give example. When I was coaching senior nurse leaders in a private hospital in Kuwait, again, multicultural environment, very diverse. It's very different actually even to the UAE. So even if we are in GCC region, every country comes with its own cultural, spiritual, societal norms. So, how I understood on a deep level how the understanding of a problem or a challenge and the vocabulary that we use is detrimental. So, imagine that in a healthcare organization, there is a daily huddle at 12 o'clock in the afternoon where the senior teams comes and we discuss issues. What is the capacity, any challenging situations, anyone needs help, what we need to do to plan for the next 24 hours. And my team comes, I ask, how are you doing? And their replies would be, I am busy, I am stressed, I am busy, I am stressed. Something really got me thinking because actually started irritating me. I did not understand this language. And at the same time, the people using this language, they were also frustrated. So it was like a continuous cycle of stress and being busy, but actually what is going on. If I cannot pinpoint the problem, I'm struggling to find a solution. So one day I asked for a definition. What is the definition of busy? Silence in the room. Okay, what is a dictionary definition of busy? And if you look at the dictionary, the definition is very vague. And every single individual in that room would have a different definition. So when we are actually able to pause, think, what do we mean by busy? What do we mean by stress? Let's describe the problem so the person in front of you can perhaps offer you a solution. So if I am the line manager and I understand what my team needs, we're going to work together to solve that challenge. When the individual also understands why they are stressed and why they are busy, they can also start prioritizing what needs to be done. And instead of running in the cycle of busy, there is prioritization, for example. So let's start using a vocabulary that is going to move us forward and is going to help us find solutions, at the same time minimize stress. So our brain is crystal clear now. I know what needs to happen, A, B, C, D, in order to move forward. So, these simple, almost like low-hanging fruits. So really simple interventions implemented has brought a powerful effect. People were less stressed. The intra-departmental and interdepartmental communication also improved because instead of working in that silo that we are talking about here in this session, running around, I'm busy, I'm stressed, and going home, I am also stressed, and I'm already anticipating that the following day I am also stressed. And this is the stress epidemic somehow explained in here. So imagine people explaining themselves better. They are upgrading their vocabulary. They're upgrading the ways that they work as a team. So no longer they suffer in silence in the corner. They are able to communicate their needs. So for me, this is like one of these magical, simple solutions that was implemented, and it has brought significant effect, positive effect, not only in that team, but also when they started using a different language. Also, they were able to communicate better with other teams. So nurses with doctors, with IT department, insurance, and so on. So this is the start of that positive ripple effect that is going to affect the organization. But then when we look at healthcare, whom are we serving? We are serving the patients. So when the nurse or a doctor is less stressed, imagine the extra benefit for the patient, for the family, and for the entire community.
So I really get this idea that what you said, that sometimes we really don't know that why we are busy, and we cannot figure out that why we are even keeping ourselves so much stressed. So don't you see that sometimes we are overlooking the sign of this workplace silos? Sometimes the employees are damaging their own mental well-being and they are really overlooking those signs.
Again, I cannot thank you enough for this question, because we as individuals, we have a responsibility. We need to take care of our own well-being. It's not the organization that is stressing me out. Yes, I understand there are some really bad places. There are some toxic places that really are adding to the stress. But on an individual level, there is a lot that we can do to understand what stress is. Yes, we are in the stress and burnout epidemic, actually. We are in loneliness epidemic in the workplace, and unfortunately it is going to get worse. I don't want to bring a depressive picture in here. For me, this is an opportunity. We are so rich in data, so when we understand how we arrived at this situation, there are opportunities what we can do about it, and on an individual level we can do a lot. We can educate ourselves, and the resources are abundant. If we're talking here about the UAE, technology, information, AI, everything is here, and a lot of these resources are free. Now, I don't want to undermine that it is not easy to not listen to the noise. So, there is a lot of information, and we are being bombarded with innovation every single day. So how do we filter through this abundance and really find solution that is gonna be good for me as an individual?
So do you think that somewhere, as you said, that we are undermining the emotional toll on the workplace isolation? Because nowadays people are working remotely. So sometimes even the organization is not able to properly communicate with them, and they're also working in isolation, particularly after the pandemic, the new normal culture. So do you see that somewhere it is responsible, the new culture which we are moving in, and how much we are really, acclimatized or habituated with that?
This question can be answered from actually two different angles, almost opposite angles. So the workplace loneliness epidemic actually is not only about remote working. What happens when individuals are in chronic stress and burnout? This by itself causes isolation. Unfortunately, people suffer in silence. But how to get out of it? The antidote is collective healing and narrative, almost sharing the collective narrative. So since the pandemic has ended, actually, yes, pandemic has shown us a lot of pain points almost that we need to address moving forward, because we cannot continue in the same reality that was pre-pandemic. So the human connection, the fact that global levels of emotional intelligence and empathy are going down year by year. This is a signal for us, and also an opportunity that we can come with interventions here and we can do something about it. So the loneliness epidemic is a very complex concept to study and to really understand the roots. For me, what is interesting in here, that stress and burnout causes loneliness. The way how we communicate, but actually how we not communicate. So we spend majority of our time at work using these digital devices. So it's almost like the art of communication is a very luxurious tool, because people lack this kind of skills just to have a face-to-face communication with your boss or with your colleague. And I will give another anecdote, because this will help us understand this issue better. Imagine that the same senior nurses team is coming to the huddle, and almost every day they will also say, well, I've sent an email or 5 emails to these individuals and they're not getting it. They're not sending the right data. They're not the work. They're not completing the project. So I started obviously coaching interventions, and I asked, so how else can you approach this situation? Majority of the time they will be silent. Well, they will say, oh, ma'am, I've told them. Okay, but you've told them via emails. I asked, can you go and talk to them? And I was like, almost like I said something that is not happened before. So almost I needed to role model what I was trying to coach. So I said, come on, let's go. And I'm taking this individual with me. We're going to go to the IT department. And I said, hi, Matthew, can we please talk for a few minutes? And we start a conversation. And again, this is how we broke a lot of silos. Few months in, all of a sudden, my nurses have a much better relationship and a communication with IT department. Some of them are friends and discovered that, they have actually so much in common. They've built that human connection, not the silo of IT, nurses, doctors, HR.
And you said really right that sometimes we can solve all the problems of silos with communication. And maybe from somewhere that initiative has to be taken. Otherwise, we always be in that impression that them versus us. So we are always thinking that the people on the other side have a different mindset, and I'm really not aligned, or perhaps I'm missing out. And there is always a fear of missing out, FOMO. So we are all dying behind that. So we always feel that, they are in a different group, and I'm missing that, perhaps. Yeah. So I also know, take from, since you have a rich healthcare background, we always know that the role of dopamine, the feel good hormone, how exactly it plays a role. What is the role of dopamine and cortisol when I talk about the work environment, and how exactly it further triggers the feel good hormone? How exactly sometimes we like something to do, or sometimes we are just doing it against our will. As you rightly gave an example that maybe somebody in your team was not willing to meet the person, and then you said then he was out of the blue that, okay, this could be possibly one of the way. So how do you see this thing happening? And generally when you meet your clients, how do you see this thing happening?
Yeah, this is a very interesting question again. So cortisol is one of the stress hormones. When individuals or teams in organizations are in the chronic stress loop, the cortisol is obviously elevated on an ongoing basis. Yes, it is contagious, but my point here is that when our cortisol levels are continuously elevated, this is promoting or leading to competitive behavior. So people compete. So you have the competition, unhealthy competition in the workplace. I'm better than this, or working in silos, our team is better, they don't know what they are doing. So really understanding this piece of science is mind-blowing, because people can then take responsibility for their own actions when they realize that they don't behave like this because they're bad humans. They behave like this because there is science behind it. And this is how our body operates. When we are stressed, cortisol is high, and it causes negative effects. One of the behaviors that is followed by high level of cortisol is that people compete instead of collaborating. So for me, this is also something that I share openly for teams to understand. And even outside organizations, if you look at those who are setting up businesses, entrepreneurs, startups, there is a lot of competition instead of collaboration, especially at the initial stage. And there is a saying that it is crowded at the bottom and it is lonely at the top. I mean, when you know these facts, then you can make an informed choice and do something about it.
And have you ever come across situations when you have seen that a particular person has really been forced to go towards a burnout exclusively because of the workplace silos? And they were really, I can say that their back is to the wall and they have no other options. And then finally they have a severe damage due to the workplace silos. How exactly you have seen that situation, and how people perhaps have come from that situation? If you can just give some example.
See, this is a very complex question. And again, burnout is a very individual case. So there isn't a same presentation. Yes, people suffer in silos. It is an individual presentation, so everyone is going to have a different story. And as I said, everyone has a responsibility for their own well-being. However, when you are stuck in a place that is particularly toxic, I don't want to overuse that word, but unhealthy culture that does not promote human connection, does not promote collaboration and promotes competition, then I've seen these situations. And again, not everyone has the strength or the courage at that particular moment in time to take a decision to do something about it. Or people are stuck in situations sometimes, right? We have bills to pay. We are in the country where our residency is attached to visa of our employer. So, there are multiple factors. It's not as easy to say, I am in the bad place, so I'm going to leave, because this is not a luxury that many people can afford.
Right.
But having that awareness, what is causing us to go into the chronic stress and burnout, is also important. So majority of people think that stress is also in the mind. Actually, our body is sending a lot of signals before even the mind gets overwhelmed that something is not right. So what I've seen with individuals working in healthcare, but also other industries, like having a chronic back pain or a tension in your, people think, oh, this is normal. I have to suffer it. But actually, when we are continuously in this tense state and we are not able to relax, we're skipping on physical activities. So work, come home, still working on our phone, going to sleep, and nothing else is happening. So it's listening to our body, listening to our mind, and trying to find that baseline. What is normal? What is not normal? How long have I been in that state? And then how do I ask for help? That's another question I think we should probably explore in this discussion is, if I come to the situation where I am chronically stressed, I keep repeating that this is my narrative, I might be fearing that I'm going for burnout, then how do I start this conversation? Is there anyone in my organization on outside that can hear me out or point me to the right resource? What can I do about it?
Absolutely. And one thing is also very clear to people nowadays, that the right environment is also very important. So if you are not in the right environment, then you have to do something which can change that situation, because you may not be that lucky to have the right environment. And to some extent, I believe it is always important that what kind of leader you are getting in your team, or what type of leader you have got in your past, or whom you are working with. So there is a leadership factor, because sometimes I see that the people who really believe in accountability, and there are people who absolutely neglect that part and who unknowingly encourage the silos. And that's why we have fragmented teams. So sometimes I find that people come to me, even because since I'm also in the same similar profession, and while I was doing my research, I came across a lot of people who are in power positions, and they are saying that, Dr. Das, we can't do anything because I find my boss is doing micromanagement. He is trying to help us, but in some way, it's not helping us. It's rather making things more complicated. So what exactly do you think that sometimes the leaders unknowingly, they are really pushing situations towards creating silos, and sometimes the way they are engaging their people may not be impacting the team in that way? What do you think?
I think what I've seen and what we now know from research, from data, that we are in a next stage of leadership revolution or evolution, depends how you want to look at it. So we have moved from leadership that used to be about the muscle to then being about the brain, and now it is about the heart. This is the new leadership style, or the leadership style of the future that is emerging, that recognizes that collective intelligence is something that is extremely important in organizations. The times where leaders had to have all the answers, and the saying that goes with it, that it is lonely at the top, so it's a one-man show and people get told what to do. I mean, this is not any longer a reality, because we know that people support what they help create. So getting them involved in the decision-making process, nurturing them, giving them opportunities for growth. I think this is something that employees value these days. And again, we have a lot of data from the Great Resignation and quiet quitting, and people will even switch jobs for opportunities that perhaps pay a little bit less, but the culture is healthier. So when I say healthier, for me, number one is that the leadership, the team leader recognizes the human in front of them. and this is the core concept of my coaching, training, and mentoring, is to acknowledge the human in front of you. It's not Premankur HR chief or an IT manager. It's Premankur as a human first. When we connect on that level, the energy, the conversation, everything flows. And we know that we have then increased productivity, engagement. People stay longer in organizations. And even if they leave, they take that, good reputation and they talk about it elsewhere instead of there is another new phenomenon, which is, I can remember the angry revenge quitting, which is another trend to watch, how revenge quitting is happening and how people are posting about it on socials.
There's also another famous, syndrome which has been very famous of late, that is imposter syndrome. So people have a lot of self-doubt. So somebody who is really trapped in silos, it's very common they will experience that they are sometimes doubting themselves. They have a self-doubt. They become automatically marginal performers, and that gradually impacts the productivity. So what exactly do you suggest for those people who are already thinking that they're trapped in silos and they want to come out of that? And they probably are already into the imposter syndrome. They are not themselves, not looking at themselves. They feel that, no, we are not the same person. Sometimes they say that when I joined the organization, I was a different person. Now totally, I'm not able to recognize myself, what I've become. So what exactly you say for that? Because that is gradually leading them to the stage of mental burnout.
Yeah, I think you are describing a very interesting situation. You know that burnout doesn't only happen because of a toxic workplace or a high workload. Burnout also happens when we lose our identity, when we no longer identify that our values align with the values of this organization, with the mission and the vision. I mean, this every time an individual's values are in conflict with organizational values, it will lead to dissatisfaction, it will lead to, as you say, decreased productivity, and this person not contributing to organizational values. So it's very interesting. Individuals should ask themselves, why am I here? And it is okay. It's normal situation that 5 years ago, this was the right place for me. I was in alignment. But then I grew. Maybe I grew in a totally different direction. And it is to say, I need to look for an opportunity, not that is better, because this can be subjective, an opportunity that aligns with who I am, with what I bring to the tables, with my values, my mission, my vision. And helping them embrace also the failure mode. So we need to try few interventions sometimes before we get a result. So it's not a tick box activity, as you wish, that we're going to try this well-being strategy and we have 100% happiness. It doesn't work like that. So really have that flexibility. I think the mental agility and flexibility framework that I work with is about embracing the unknown. So just seeing what is there, looking at solutions, connecting with others. So the collective intelligence. I don't have all the answers. So I'm going to go and ask Premankur, and together we can produce a much stronger strategy, something that is going to work much better than I would if on an individual level.
Absolutely. I really agree. And I'm so thankful to you, Magda, for joining this wonderful conversation. And I will look forward to have more conversations with you in coming future, in near future. And let's try our best to bring a change so that there is a better world, a better workplace for beautiful minds, and let us help them who are really in need. And I cannot thank you much for sharing all those golden takeaways, which were so meaningful. Thank you. Thank you so much.
Thank you so much. I have enjoyed it a lot and hope everyone else is gonna get some useful tips from this conversation.
Bye. Thank you. Take care. So bye to our audience. And so far, it was a wonderful conversation. And here, Dr. Das sign off from Celeb Talk.